Welcome to G Fun Facts Online, where we dive deep into the fascinating world of science. Imagine this. You've just undergone life-saving brain surgery to remove a tumor. It's a moment of incredible relief. But then, you try to speak, and the words just aren't there. You're lost in a sea of language, unable to grasp or express thoughts that were once second nature. This isn't a plot from a science fiction movie. It's the reality for many who face a post-surgical condition called aphasia. Aphasia is a language disorder that can impair your ability to speak, understand, read, and write. When a brain tumor grows in or near the language-dominant part of your brain, which is the left side for most people, the risk of developing aphasia after surgery is significant. It's estimated that between 30 and 50% of patients with primary brain tumors will experience it at some point. So, what's happening inside the brain? Our brain is an intricate supercomputer. Specific regions, like the frontal lobe for producing speech and the temporal lobe for understanding it, work together in perfect harmony. A tumor, which is simply a mass of abnormal cells, can disrupt these delicate networks. The tumor itself, or the essential surgery needed to remove it, can damage these eloquent areas, leading to what can feel like a wordless void. Now, you might think aphasia is something that only happens after a stroke, but aphasia from a brain tumor is a different beast. A stroke causes a sudden loss of blood flow, resulting in immediate and often severe damage. A tumor, on the other hand, often grows slowly. This gives the brain a remarkable chance to adapt through a process called neuroplasticity. The brain can literally rewire itself, shifting language functions to other, healthier areas to compensate. Because of this amazing adaptability, the aphasia seen in brain tumor patients is often milder and more temporary than post-stroke aphasia. The most common type is anomic aphasia, which is a frustrating difficulty in finding the right words, especially for naming objects. For neurosurgeons, removing a tumor from a language area is like the ultimate high-stakes tightrope walk. Their primary goal is to remove as much of the tumor as possible to improve the patient's prognosis, while simultaneously preserving critical functions like language. To achieve this, they use incredible techniques like intraoperative brain mapping, often during an awake craniotomy. Yes, you heard that right. The patient is awake during parts of the surgery. The surgeon can stimulate the brain's surface to map out exactly which parts are essential for language, so they can navigate around them. Even with this incredible precision, temporary post-operative aphasia is still common. The path to recovery is a team effort. At the forefront are speech-language pathologists, or SLPs. They are the language coaches, conducting assessments and creating personalized therapy plans to retrain and strengthen the brain's language skills. They work closely with neuro-oncologists, who manage the overall cancer treatment, and neuropsychologists, who assess the broader cognitive impacts on memory and attention. Rehabilitation is a dynamic process. Therapies can include restorative exercises to rebuild impaired skills, or learning compensatory strategies like using gestures, drawing, or communication aids. There's even an intensive method called constraint-induced aphasia therapy, which encourages the use of spoken language by restricting other forms of communication. And of course, in our modern world, technology is a powerful ally. For those with severe aphasia, augmentative and alternative communication devices, or AACs, can be life-changing. These can be anything from simple picture boards to sophisticated tablets that use icons and text-to-speech technology to speak for the user. There are also countless smartphone and tablet apps designed for aphasia therapy. On the cutting edge of research, scientists are developing brain-computer interfaces, or BCIs. This groundbreaking technology aims to decode brain signals related to the intention to speak and convert them directly into spoken words. While still in early development, it holds immense promise. But the challenges of aphasia go beyond communication. The condition can be incredibly isolating, leading to feelings of frustration, anxiety, and depression. Imagine not being able to participate in conversations, share your feelings, or connect with your loved ones. This is why a supportive and patient environment is crucial. For many patients, the aphasia experienced after brain tumor surgery is temporary, with significant improvements seen in the first few months. However, the road to recovery is a journey of incredible resilience. Every word relearned, every sentence formed, is a testament to the human spirit's capacity to overcome adversity. While aphasia is a daunting challenge, it's important to remember that it does not diminish a person's intelligence or their capacity for a rich and meaningful life. With the right support from dedicated healthcare teams and the promise of ongoing technological advancements, there is more hope than ever for patients to find their voices again. Thanks for tuning in to Fun Facts Online.